The transfer of a critically ill patient to the ICU from either the ED, the OR, or the medicine floor is a crucial part of any hospitalization. Given the patient's critical status, it is imperative that all team members, both transferring and receiving, are on the exact same page. This highlights the importance of having a very diligent and standardized transfer of care process. Historically, this transfer of care and handoff has been done on a more individualized or private basis, with the receiving RN in the ICU getting handoff from the transferring RN, and the receiving RT in the ICU receiving handoff from the transferring RT or a CRNA if the patient's coming from the OR. Here at Our Lady of the Lake, we aim to transition from this separate, individualized process to a more patient-centered approach, placing all of these team members simultaneously at the patient's bedside so that all patient support systems can be both accounted for and verified to be functioning properly. Let's take a look at how this process should play out. When a patient is critically ill, the house manager will receive a request for an ICU admission or transfer. They'll subsequently place that patient in an ICU room and the transfer process is initiated. If the patient is coming from the ED to the ICU, the ED RN as well as the ED respiratory therapist will accompany them to the ICU. If the patient's coming from the OR, the CRNA on duty as well as the operating room RN will accompany the patient to the intensive care unit. While the patient is being transferred, the ICU RN as well as ICU respiratory therapists will prepare the room for their arrival. This includes readying any IV pumps, drips, and a ventilator if necessary. The patient arrives at the ICU and there is a collaborative effort to transfer the patient to the ICU bed. The ICU respiratory therapist works to transition the patient from the transport vent to the in-room ventilator. Meanwhile, the ICU RN will work to transition the patient from the transport pump to the in-room IV pump. The ICU respiratory therapist checks the ventilator to ensure that it is active and has the appropriate settings. The ICU RN then begins their assessment of the patient. This includes 2ID verification, checking along with the transferring nurse for any pressure-related injuries, and then finally verification of any active drips the patient is currently on. After verbal handoff is completed, the ICU RN scans the QR code on the wall and completes the associated questionnaire. The ICU RN will document their name, the patient's MRN, whether the patient is actively on a ventilator, whether the information transfer was completed appropriately, and whether the technology transfer was completed successfully.